Good afternoon, everyone. Thank you so much for joining us this afternoon. My name is Jessica Zavala, and it is my pleasure to welcome you on behalf of the Ohio Program for Campus Safety and Mental Health to today's webinar, Comprehensive Approaches for Addressing Student Mental Health Needs and Opportunities for First-Generation Students. Before I introduce the presenter today, who is certainly a friend of the Ohio Program for Campus Safety and Mental Health and not a stranger to Ohio, I do have a few brief announcements to share. CME and CEU credits are available, and the activity code for today's session is 14 SOAP. That is 14 SOAP. This code will expire on January 27th, and that's tomorrow at 12 p.m. Please be on the lookout for information periodically posted via the chat function regarding how to obtain credits if you are interested. Next, we invite you to join us for our next webinar, which will be Thursday, February 16th at 12 p.m. We will be joined by Dr. Russell Speed, Vice President of Adult Behavioral Health at the Centers in Cleveland, Ohio. He will present on motivational strategies to engage students violating the code of conduct. Also, we hope that you will join us in person for the 6th Biennial Conference, Reimagining Campus Community Partnerships, which will be held on May 18th in Columbus, Ohio, at the Quest Conference Center. A call for presentations and posters has been released, and registration details will be forthcoming. Also, just please be on the lookout for other upcoming events via our website, and like and subscribe to our social media channels. For today's presentation, we encourage you to post questions and comments. You can use either the Q&A or chat function. And finally, this webinar will be recorded and the video will be made available for viewing on our YouTube channel. And now to introduce our presenter, Dr. Sara Abelson is an assistant professor and senior director at the Hope Center for College, Community, and Justice at Temple University. Dr. Abelson has worked at the intersection of research and practice in higher education for nearly 20 years to advance student mental health, well-being, equity, and success. In addition to many accolades and prior to the Hope Center, she served as co-investigator and lead for diversity, equity, and inclusion projects with the Healthy Minds Network. She has helped disseminate findings from the largest study of college student mental health and spearheaded data collection investigating from college policies, practices, and experiences shape the lives of marginalized and minoritized students. She has also served as Vice President of Active Minds, consulted and collaborated with the American Council on Education, Center for the Community College Student Engagement, Association of Public and Land Grant Universities, Association of College and University Educators, JED Foundation, the National Center for Institutional Diversity, the Steve Fund, and many others to advance holistic, equitable supports for student well-being. So without further ado, Dr. Sara Abelson.
Great, thank you, Jessica. Thank you everyone for being here today. I've enjoyed my work with the Ohio program over the years, and it's great to be back. And this is reminding me how long I've been at this work, but really glad to be here today and delighted to be speaking with all of you about comprehensive approaches for addressing student mental health with a particular focus on needs and opportunities with first-generation students. Again, thank you to the Ohio Program for Campus Safety and Mental Health for having me, and to all of you for your investment in this issue and your students. As Jessica mentioned, my name is Sara Abelson, and I'm an assistant professor and a senior director at the Hope Center for College, Community, and Justice. The Hope Center is a national action research center working to transform higher education into a more effective, equitable, and impactful sector. We conduct applied scientific research, education and training services with colleges and universities, policy advising, and strategic communications with the aim of reducing basic needs insecurity and making college more accessible, affordable, and attainable. As she mentioned, my work in scholarship has focused on identifying upstream approaches for colleges and universities to enhance mental health equity. And I've been at this work through in partnership with a number of organizations and entities over almost 2 decades, and I think have partnered with several of your institutions along the way. My plan today is to start with a brief overview and introduction to student mental health nationally. I imagine much of this will be familiar to all of you. Then I'll include a focus on first-generation students and talk about the need and opportunity for investing in student mental health through a public health approach. I'll spend some time reviewing what we know about what works and doesn't in terms of interventions based on a recently published review I conducted with my colleagues. And then I'll wrap up by sharing some resources and supports for your institutions as you invest in first-gen students and their mental health. I'm going to aim to leave plenty of time at the end for questions. The data I'll be sharing today come from a number of sources. In some cases, I'll be summarizing findings that have been seen in common across multiple studies and data sources. I'll present some of my own research analyzing Healthy Minds survey data along with my colleagues. And in addition, I'll be sharing data points from the Hope Center 2020 survey of student basic needs. The next administration of the Hope Center survey actually just launched this month. And here's a quote that came in from a participant this week. I'll be sharing 2020 survey data that was collected from over 200,000 students attending 202 colleges in 42 different states. What do the data tell us about the state of college student mental health? Mental health disorders are common, consequential, and largely untreated on college campuses. My colleagues and I analyzed data from the National Healthy Minds study, again, that has been conducted at hundreds of colleges and universities since 2005. The survey is administered to a random sample of students at participating institutions and includes clinically validated mental health screening instruments, which assess symptoms of mental health disorders and have cutoff points for suggesting a likely diagnosis if the person were to see a clinician. The survey assesses for anxiety, depression, eating disorders, non-suicidal self-injury, and suicidal ideation. Looking between 2013 and 2020, we find that the percent of students struggling with one or more of these mental health problems has risen from 40% to 60%. This research is published in the journal The Affective Disorders. High rates of mental health problems in college are a product of some students coming to college with these problems and other students developing them while in school. College is not a risk factor per se. College students are at approximately the same risk of problems as young adults not in college. But college presents opportunities to exacerbate or mitigate existing problems and to prevent problems where they haven't yet developed. The proportion of students struggling with mental health problems, as I'm sure you all have been noticing and seeing at your institutions, has clearly been on the rise for years, since well before the pandemic. However, the pandemic has further exacerbated the issue, adding stressors and inequitably increasing mental health risk factors, particularly taxing low-income students and students of color. For example, in our 2020 Hope Center student survey, we found that 13% of students report losing a loved one to COVID-19. 31% of students report experiencing a job loss as a result of the pandemic. And Black-white disparities in basic needs insecurity increased. Grief, job loss, and financial strain, basic needs insecurity, including food insecurity, housing insecurity, and homelessness, these things all negatively impact mental health. Data from Healthy Minds, the American College Health Assessment, the Center for Collegiate Mental Health, they all indicate that throughout the pandemic, students reported higher levels of severe depression, higher levels of academic impairment associated with mental health distress, and increased barriers to accessing mental health services. Perhaps more concerning than the high proportion of students struggling with mental health symptoms is just how many students are struggling without services that are proven to help. Only half of students screening positive for one or more mental health disorders have received therapy or medication in the past year. Again, looking at recently published Healthy Minds data that my colleagues and I analyzed, we found that treatment rates have been increasing since 2013, which college counseling centers are certainly feeling and experiencing, but still most students who are struggling are doing so without care. Unmet mental health needs are prevalent, as you see, among all students, but significant inequities persist, such that some students are experiencing a greater burden of concerns and others are even more likely to be struggling without services. Students of color experiencing symptoms of a mental health disorder are far less likely to receive treatment than their peers. Students attending community colleges are less likely to receive services than students at four-year institutions. Community colleges are less likely to have college counseling centers and tend to offer fewer services than their four-year counterparts. Sexual and gender minority students experience a significantly greater burden of concerns than heterosexual cisgender students. First-generation students are another population facing inequities. The definition of first-generation students, a term that was coined by the Council for Opportunity in Education in 1980, varies from institution to institution. I'm curious if you all know how your colleges are defining and identifying this population. Feel free to enter that into the chat. We know that some schools classify first-gen students as those whose parents, guardians, or caregivers did not attend college. Currently, about 24% of undergraduates fall into this category. Other places classify first-gen students as those whose caregivers or parents, guardians did not graduate from college. This applies to about 56% of undergraduates in the US. However you define it, the population is growing in higher education. First-gen students, compared to continuing generation students, have fewer financial resources. They are more likely to be Black, Indigenous, or people of color. They are more likely to be parenting students and have dependents they are supporting while in school. First-gen students are more likely to work part or full-time while attending college, and they're more likely to be older than their counterparts. We find that first-gen students are also more likely to experience basic needs insecurity. Again, from the Hope Center 2020 survey, with over 202 colleges and universities, we find that mid-pandemic, 64% of first-gen students experienced food or housing insecurity or homelessness, compared to 55% of non-first-gen students. As many of you likely know, and it's maybe partly what brings you to the presentation today, research shows that first-gen students often confront significant obstacles in accessing higher education, in succeeding after enrollment, and graduating. About a third of students whose parents didn't attend college drop out, compared to 26% of students whose parents attended some college and 14% of students whose parents have bachelor's degrees. When first-generation students do graduate, the college degree doesn't always pay off as well for them. They tend to have more trouble landing jobs, and they earn substantially less 10 years after receiving their degrees. According to federal data, nearly 74% of first-generation students in the class of 2015 to 2016 borrowed money for college, compared with 64% of their peers. And just over a third of first-generation students default on their loans, compared to 20% of peers who have a parent with a bachelor's degree. The situation is even bleaker for low-income first-gen students, nearly half of whom default on their loans, according to the Center for American Progress. In terms of mental health, first-gen students, compared to continuing generation student peers, report greater levels of depression and stress, lower use of mental health services, and lower levels of belonging. I'll mention here, though, sort of nerding out on some data and work from my colleagues that I admire, that there's a recently published very cool study using mobile phone sensor data with students at Dartmouth College. And they followed first-year students over an entire year regularly through mobile sensing technology. And they found that first-year, first-generation students had higher mean scores on a depression screener over the course of the fall semester, but that the difference between first-gen and non-first-gen students was no longer significant in the winter and spring terms. And they hypothesized that some real level of adjustment and acclimating was happening through supports at the institution. So that is something for future research to investigate as we follow trends in first-gen mental health and how it varies over the course of their experience at the institution.
Sarah, this is Jessica. There was a brief question that popped up, and I don't know if you'll get to it later, but it's regarding how I believe first generation students are really defined. And that question is, what if a step parent has a post-secondary degree? Would that child no longer be considered first generation college student? And then does it depend at what age this step parent gets involved in parenting?
Well, those are great questions. And again, the answer here is that it really varies. So it really depends on the data source and the institution. So it points out the importance of sort of investigating what is being used when the data is presented. So I know about this even from our own survey research, that the language we use and how inclusive we are, some sources ask only about parents, others extend it to recognize students vary in whether they're parented or have caregivers or guardians. So there is not a universal answer there. Again, it really varies to the data source and the institution, how they are assessing it and who they are classifying in this group. I will note too, even some sources classify first generation when the parents didn't attend college until they were older. So perhaps they had some experience, but maybe they didn't pursue that degree until the student themselves, their child, was in pursuing their degree. So it really, there isn't a universal answer there. It varies by source and by college. It's a great question. Thanks. So I started again, have sort of gave a whirlwind tour of the scope of the landscape and how high levels of need are currently with students and some of the unique needs and challenges faced by first gen students. And I really want to emphasize that I think this is an absolutely critical moment and time for investing in student mental health. And particularly focusing on first gen students, as we know that colleges is becoming less and less affordable and less attainable. We also know right now that from the White House to the Surgeon General to college presidents, our nation is really speaking up about and focusing on the importance of investing in youth and young adult mental health. Throughout the pandemic, we heard from the American Council on Education that regularly surveys college presidents. They consistently ranked student mental health as their top concern. This was during the pandemic while we had so many things they were juggling, but again and again, they ranked student mental health as right up there of the things they are paying attention to and needing to address at their institutions. We've also seen in our work that there's some additional funding available. Institutions and states are finding ways to put pandemic relief funds to use to better support student mental health and well-being. So it could not be a more important time to be taking action and figuring out where to best invest in student mental health. It is really worth it to intervene and to invest. The proportion of students struggling with mental health care has significant negative consequences, not only for students, but for colleges and universities and society. We know that untreated mental health disorders are associated with lower GPA, with enrollment discontinuity and dropout. Longitudinal research by Daniel Eisenberg and colleagues has showed that being depressed in college is associated with 2 times greater risk of departing without graduating. More than 3 in 4 students report that their mental health interfered with their academics 1 or more days in the last month. Early prevention, detection, and treatment of mental health disorders in higher education will improve academic outcomes, career trajectories, lifetime earnings, health, relationship satisfaction, and more. It will also save lives by enhancing by preventing suicide. Addressing mental health is a potentially powerful lever for enhancing student access, college access, and attainment for first-generation students. Investing in student mental health also makes economic sense for colleges. Reducing depression among students leads to increased retention and student satisfaction, which benefits colleges through increased tuition and improved institutional reputation and alumni donations. It benefits society and students through increased lifetime productivity and earnings. We must, however, move past simply increasing counseling services. Despite the approximate doubling of mental health service use during the past 10 to 15 years, the rise in mental health distress, as I showed, continues unabated. Mental health services are critically important and effective, but demand will continue to outpace availability and capacity, and we will simply never address this issue simply by doing counseling alone. Population health and population level public health interventions that focus not only on supporting students who are struggling, but preventing problems from developing in the first place are desperately needed. We also have an opportunity to focus on addressing root causes. Knowing, for example, that experiencing basic needs insecurity leads to mental health problems, we need to change our systems and make college more affordable so that 3 in 5 students aren't left experiencing basic needs insecurity while students, rather than simply trying to treat their mental health problems once they've been struggling with food and housing insecurity while trying to complete their degree. Implementing this vision for a public health approach to student mental health is not easy. One of the primary difficulties is the lack of clarity about which specific preventative approaches are most effective. Campus communities are using a wide variety of prevention intervention strategies that might be helpful, but it is often unclear whether and to what degree these interventions are actually effective. A growing body of research evaluates the interventions, and that work has been increasing, but the literature is scattered across academic fields and journals. To bring coherence to the large volume of information and to provide guidance to campus leaders and honestly equip myself with a resource I've wished I had as I've done my work in the field, I conducted a comprehensive review of the evidence regarding public health interventions for addressing mental health in higher education, along with my colleagues, Dr. Eisenberg and Lipson. The review is available in the Higher Education Handbook of Theory and Research. While I can't do full justice to this 80-page review, I'm going to provide some top-line summary and key takeaways in our time together today. We identified a few intervention approaches with strong evidence of effectiveness based on evaluation studies to date. These are strategies in which college leaders can invest in with confidence. They've been investigated in numerous ways and shown significant positive effects. Extensive evidence suggests that skill training interventions effectively promote positive adjustment and prevent negative adjustment in college students. Skill training interventions teach students social, emotional, and coping skills to prevent mental health, to promote mental health, and to prevent mental health problems. Supervised practice, which involves behavioral rehearsal and supportive feedback over multiple sessions, is an essential but not universally employed component of effective skill training interventions. There are several different types of skill training interventions. Mindfulness programs with supervised practice have the most consistently positive evidence. They have been shown to improve socio-emotional skills such as coping, positive thinking, emotional and stress management, to enhance self-perceptions, to reduce emotional distress, to reduce mental health symptoms, and to enhance well-being, flourishing, and sleep. Cognitive behavioral and relaxation interventions with supervised practice show promise for improving social-emotional skills and reducing psychological distress. In contrast, meditation programs with supervised practice have minimal evidence for effectiveness. Another effective strategy that colleges are employing and has been well evaluated in the literature are screening interventions. screening routinely for mental health concerns such as depression, anxiety, and suicide is a strategy that many colleges are implementing. Several studies have shown that screening for mental health symptoms and suicidal thoughts and behaviors in school settings can effectively identify and link at-risk individuals to care. Of course, screening programs are only effective to the extent that evidence-based mental health services are available. We know that is a challenge. Given that most campuses are struggling to keep up with current demands and needs for mental health services, any effort to expand screening programs must be paired with an efficient system for triaging students with the greatest needs into the appropriate levels of care. Although most robustly evaluated higher ed mental health interventions focused on individual students, such as training them and supporting them to develop skills, colleges and universities have important opportunities to support mental health through improvements to the broader campus environment. Schools may reduce mental health risks, for example, through the physical environment by restricting means to suicide. In campus settings, this includes installing barriers or nets and bridges and rooftops, and doing other alterations to the physical environment. Means restriction, including managing guns effectively on campus, is one of the few suicide prevention strategies with proven effectiveness. The flip side to investing in strategies with strong evidence is revising or abandoning strategies with weak evidence. I'm not referring here to strategies that have incomplete evidence, so have not been well evaluated, but rather strategies with substantial evidence of disappointing results. Psychoeducational interventions are didactic programs that focus on providing mental health information. They target students' knowledge and attitude towards stress and coping, mental health symptoms, and mental health resources, with the hopes that telling students and giving them information will enable them in the future to prevent or respond to future distress or symptoms and seek help if needed. Across a large number of studies, settings, formats, and populations, psychoeducational interventions for mental health have been shown to be minimally effective in improving attitudes, in changing behaviors, and fostering skills, or in preventing problems. They have been found to be largely ineffective, whether they address social emotional skills, stigma, sleep, or eating disorder prevention. And they've been shown to be relatively ineffective, whether they're delivered in person or via technology. Overall, the literature strongly indicates that college leaders should not invest in psychoeducation as an independent or a primary approach to address student mental health. This is not to say that psychoeducation in all forms should be abandoned. Although it typically has minimal impact when employed by itself, it's often a key part of a multi-component intervention. For example, many skill training interventions contain some level of psychoeducation, but they become effective when they're paired with skill training and supervised practice. Another type of intervention that has questionable effectiveness, though it is being employed by many institutions, is gatekeeper training for non-mental health professionals. These are prevention programs that seek to increase knowledge about mental health disorders and enhance the ability to identify community members who are in distress and connect them to appropriate services. These trainings are meant to change community norms and behaviors around recognizing and responding to signs of mental health distress, but they have mostly been assessed by measuring learning and skill acquisition only among those who are trained. Evaluations have shown positive outcomes among trainee attitudes, self-efficacy, for example, one's perceived ability to refer someone to help, self-perceived intervention skills, and intention to intervene. Yet 3 college-based studies have found no effects on trainee actual behaviors. In other words, actually intervening or referring others to care. And an unusual study that actually examined help seeking and service use among community members meant to benefit from gatekeeper trainings, in this case, it was student residents when their RAs were trained, detected no effects on the target population, even among residents with significant symptoms. As is the case with psychoeducation, we were not recommending an abandonment of gatekeeper training. It is encouraging that trainees are more knowledgeable and confident in their skills in most evaluations. And there's no reason to think these programs are harmful. They're probably doing some good. But that said, the evidence indicates that as a field, we really need to push for stronger outcomes for gatekeeper programs. And as we decide where to invest limited funds, we really want to be making sure that we are seeing impacts among the students with highest levels of distress and that they're actually working to connect those students to care. Whereas there are relatively few interventions with really clear evidence of being effective or evidence of not being effective, there are far more strategies that have some promising but incomplete evidence. These strategies warrant continued experimentation by colleges and universities, as long as we are also evaluating the outcomes as we do the work. Peer health education and peer health support programs have begun to show some effectiveness in higher education and have substantial evidence of effectiveness in other settings. Peer support in particular has been found to be sometimes a challenge and particularly important for first-generation students, both mental health and academic success. So this is likely a key intervention area to further explore. Just to give one example, perceiving a competitive classroom environment was found to be strongly linked to experiencing symptoms of depression among first-generation students. But the relationship disappeared when these students report having strong peer support. Similarly, sense of belonging has been shown to be a challenge for first-generation students, but hugely important for their mental health and academic success. There is growing evidence that sense of belonging is modifiable through intervention with students. These interventions not only produce health and academic benefits, but help reduce disparities. There has been strong support for these interventions through a series of randomized and rigorous randomized control trials. I don't have time to talk about these next set of interventions in great detail, but there is growing evidence that's beginning to document positive mental health effects from interventions in the learning environment. There are numerous opportunities for colleges to foster supportive learning environments, and a growing number of mental health focused courses are beginning to be assessed for their effectiveness. One category of learning environment interventions that I will star and mention today are those focused on mentoring. College students from traditionally unrepresented backgrounds who retain a greater number of natural mentors through their first year of college show reductions in depressive symptoms across the year via enhanced self-worth and reduced psychological distress. Students who feel more emotionally close to mentors report less depression and worry at follow-up than students less connected to their mentors. Research has shown mentoring programs to be especially important and effective for first-gen students. And as your colleges design and implement and evaluate these programs, I would encourage not only focusing on academic impacts, but investigate what are their mental health outcomes. I'll begin to wrap up now by highlighting a few innovative intervention approaches, which have not yet been substantially evaluated for mental health benefits among college students, but both theory and evidence from other settings suggest they are strongly worth exploring further in higher education. We need more research designing and evaluating interventions that prevent discrimination and support student sense of identity. We definitively know from numerous studies that discrimination harms mental health, but there is frustrating little evidence or agreement regarding the effective interventions for reducing discrimination and preventing microaggressions. While discrimination should absolutely be prevented, research also demonstrates factors such as racial and cultural and identity pride and self-acceptance that can protect students from the mental health consequences of experiencing discrimination. Identity support intervention that supports students' sense of identity, including but not limited to racial, ethnic, sexual, or gender identity, are a potentially powerful but mostly unexplored strategy for impacting mental health in higher education. If any of your institutions are employing work in this arena, I would love to hear about it and learn more. Families also impact psychosocial adjustment and are an important source of social support in college, especially for first-gen students. But in our research and our review of the literature, we were unable to identify any higher education interventions focused on families that have been evaluated for their impact on student mental health. This is much needed work. Focusing, excuse me, battling a daycare cold. Focusing on first-gen students would be a great place to start. Given how many first-gen students are parenting while in college, we should also consider examining the mental health impacts of providing housing, childcare, and employment supports to parenting students. One final broad and large category of interventions that are worth exploring and assessing at your school are those that change campus policies to better support student health and well-being. Institutional policies pertaining to substance use, sexual assault, leaves of absence, financial aid, and diversity, equity, and inclusion are likely influencing the mental health of your students. Changing policies, such as expanding your non-discrimination policy to protect transgender and gender diverse students, literally, it costs nothing, nothing to the institution, and has been shown to impact mental health outcomes such as depression and suicide. Enhancing financial aid and reducing burdens and stressors associated with applying and receiving these funds is a powerful way to enhance basic needs security among entire populations of students on campus, which we know will benefit their mental health. As one example there, qualitative research has shown that access to financial aid through the California DREAM Act reduce undocumented students' anxiety and mental health burdens. I want to leave you with several resources as you pursue this most important work at your colleges. The Hope Center offers a wealth of reports and briefs on our website. For example, I wanted to star a recent brief on parenting while in college that shares data from the Hope survey and is relevant to meeting the needs of your first-gen students, again, given how many of them are parenting while in college. You can find many more resources at hope.temple.edu. The American Council on Education offers a growing series of helpful resources focused on student mental health. I'm starring this one here, a resource that I created resource I created for college leaders with my colleagues a few years ago. But also soon there will be a new brief that's summarizing the intervention research that I reviewed with you all today. I imagine that will be out in another month or two through the American Council on Education. Many of you may also be familiar with these resources, but the Chronicle of Higher Education Student Success Resource Center, as well as the NASPA First Generation Resource Center, both have a wealth of great resources focusing particularly on first generation students. Last but not least, I really want to extend a very warm invitation to all of you and all of your colleges to partner with us at the Hope Center. We are currently enrolling colleges in our Hope Impact Partnerships program, through which we support recovery efforts and advance equity in college attainment by providing education and training services to help faculty and staff advance student basic needs efforts, anchoring in data and research. We provide support to participating institutions to collect, analyze, disaggregate, and visualize data on student basic needs and campus policies, while getting technical assistance to plan and take action to improve students' basic needs security and well-being. We're interested to work with you and your colleges to help integrate your basic needs and your mental health efforts, and to adopt and pursue evidence-based best practices for addressing these issues. Participating in Hope Impact Partnerships also provides the opportunity to administer the Hope Basic Needs Survey at your college, and I referred to many data points from that survey today. When it comes to student mental health, we are also at the Hope Center doing substantial advocacy at the federal and state levels. And I invite you to visit our website to join us in that work and see ways to participate. We know that the challenge of student mental health will not be addressed by colleges alone, and we must be addressing these issues at all levels of our system. With that, I'm going to pause. I see some questions already coming in that I'll turn my attention to. I invite you to populate it with with others, and look forward to having a robust conversation with you about your current work at your institutions. Thank you.
Thank you so much, Sarah. There's just so many nuggets with the data and the research that was shared. And I just want to encourage everyone, as Dr. Abelson mentioned, to go ahead and post your questions and answers. There are a number of them already pending. And I also too want to just briefly apologize. The chat was enabled or disabled, excuse me, during the beginning. And so there was a question from Dr. Abelson. If you could go ahead, please, and just, if you're comfortable in sharing how your organization, how your institution is defining a first generation student. It will be helpful for us even to know, because it seems as though from what I'm seeing in the chat, that really depending on the institution, that is very widely ranging. And that's even a question from me, Dr. Abelson. Do you know whether or not there's any sort of universal work or efforts to more so have a more universal recognized definition for first generation students?
Yeah, that is a great question. Again, I think it depends a bit on like the circle you're operating in. So it is certainly defined in some common ways, like on federal forms and through FAFSA as it relates to distribution of the Pell Grant. I know various college systems are sort of unifying their definition. So I do think those efforts are going on. I can't really speak to each and all of them all over the country, but I do think there are some efforts to synchronize it, while also recognizing there's value to be looking at the full scope of the population. So knowing that any one definition may also exclude some students. And so I see colleges sort of both doing work to sync up on common definitions, but also really, I think this points to the importance of analyzing data on your students. So knowing fully about who they are, knowing not just, one data point on their parents' education, but understanding more clearly how many of their parents went to college, did they go to college, or did they complete the degree? How is that shaping their current experience in school? And so, yeah, I think the value to me basically is diving in deep to the data so we can really understand a more complex picture about these students' experiences.
Excellent, excellent. And so there are a number of questions, and it seems as though there's a common thread regarding mindfulness practice. And so I'm sure you're able to see those. And so maybe expanding on the definition of mindfulness practice and, in terms of what the studies are sharing regarding the effectiveness. And so that's where it seems that the question is going.
Yes, I appreciate those questions. I will here have to refer you to the article, and I can send it to you. Again, this is it was a massive undertaking and a huge range of interventions. So I will just own I am not an expert, particularly on mindfulness and meditation interventions. I was reviewing a wide range of studies. I do wonder, and will again highlight just the importance of supervised practice to the effectiveness of skill training interventions. And again, this is a total hypothesis without being a total expert in this particular field, but I do wonder whether there's something about mindfulness that is more able to be taught to college students with supervised practice, perhaps, than meditation. I don't know. But there are, again, have been a wide range of studies and particular interventions that have been evaluated that we refer to and dive in detail about in the chapter. So I can send that and share that as a follow-up resource and highlight that particular section that I hope either answers or refers you to the sources to learn more about how these interventions are defining and distinguishing between mindfulness and meditation.
Absolutely. Thank you for that. And yes, now in addition to the article and the other resources that you will send as a follow-up, I just want to remind everyone that we will also send out the PowerPoint slides, because I believe there was a request to share the previous slide coalition letter to Congress. And so, yes, we will also share out the slides. There's another question regarding providing an example of a belonging intervention. Be able
Yeah.
to share a little bit about that.
Yes, absolutely. And again, I'm not trying to just promote this article, but if you want specific links to the particular interventions and the references to learn more about them in detail, you will find that there. I will describe some types of belonging interventions that the studies and have been put through rigorous randomized control trials. Some of the initial work came out of researchers Greg Walton, and Spencer is another name of a researcher on some of the belonging work. But they have studied interventions in which students come into college and get some coaching from upper level students who help narrate to them and help them understand sort of the challenges of college, and really prepare them for the challenges they'll encounter and help them recognize that it is not about sort of them and it's not unique to them. So again, they have a lot of details about exactly their approach and strategy, but they have the intervention involves these upper level students writing letters to and spending some time really educating and sort of shifting our students early in their career trajectory, how they will encounter and interpret challenges that they face along the way. And their work has shown that this then has an impact by shaping how students then sort of approach the challenges they encounter throughout their experience. So they have research sort of following the students over time, and they show that these students are more likely to seek out mentors and to seek out resources and support as they encounter challenges. And then again, they've studied these impacts over time. And so these interventions have been done focusing on reducing racial disparities and reducing disparities between Black and white students when it comes to academic achievement and health outcomes. But there have also been studies both in the US and in other countries focusing on low income students and reducing socioeconomic gaps in both health and academic outcomes. So again, I can link you to the chapter that refers to in much more detail to specific interventions and points you to those studies to learn more about them. But I hope that gives a little flavor and taste of some of the work that's been done.
Excellent, excellent. Another question here. You had talked about strategies that had been proven ineffective, and in particular, psychoeducation and gatekeeper. First question is whether or not there was a particular gatekeeper training that the study identified or that the research showed.
Yeah, so again, in doing a literature review here, the findings are not based on one study. So it's based on, we were able to come to these conclusions when there were multiple studies across multiple types of programs coming to the same conclusions. So as you can see in the review, the studies have been done of many, many different types. And I'm not even going to mention specific names. You all are probably familiar with them. There's many in higher ed. But across the various intervention gatekeeper programs, there have been commonalities in finding that the trainees themselves show some improvements in their attitudes, some reduced stigma, feeling like they're better prepared to respond. But again, across many different studies and many different gatekeeper programs, we have the research has not documented impacts on actual referral behavior. And then a few studies, because not many have been done, have actually looked at the impact on the populations we're trying to shape. And that's where, again, we have not seen effects.
Wonderful. Thank you for sharing that. And then as a follow-up to that, I'm certain that, you mentioned in terms of, I think the research showing that it was, residential students, residents, and that they did not find this to be effective. Was there anything in particular for any other particular prioritized student population that was identified that maybe you can share or expand?
Yeah, I appreciate that question. And the reminder to caveat all of this to say, this is a review of the literature there's also limited by limitations in the research literature. So one thing that we do talk about in the article that I didn't get to go into great detail today is really the need for more research. So one thing I will point out is that much of the evaluation research has been done with white women at four-year institutions. One weakness of studies is that they don't all even attend to student characteristics in the setting in which they're being implemented. But where the studies do report who they've been doing the work with and in what settings, primarily and predominantly, they have been done, just the samples are largely white, it's largely women, and it's largely at four-year institutions. Again, promisingly, where some studies have looked at it, they have found effects across populations. So I did try to star, peer programs in particular have been shown to be effective, particularly amongst various different student groups that have experienced marginalization and minoritization in higher ed. I also highlighted some policy change initiatives that would be particularly effective for specific populations. But I would really conclude that overall, we need to do a better job of really studying particular interventions with particular populations and diversifying who we're working with and where we're paying attention to effectiveness.
Wonderful, thank you. I'm going to expand on the question that was presented earlier about providing an example of a belonging intervention. And you mentioned that for first generation students, that it is a challenge for them really to connect and, really have that sense of belonging on a college campus. Within your research, are there certain, I know, of course, you listed peer programs and other types of programs, anything that else that you can include or expand upon for helping first generation students to really, have that sense of belonging, that sense of connection on college campuses? Might you be able to share a few more examples?
Yeah, that is another great question. I think I will just sort of draw attention to an area of work that has captured my own interest and attention that I'm following. It's not so definitive yet. This is an area where I think more work is needed. But there have been several researchers advocating to think about belonging not only on an individualized level, so how do I help this one student have a greater sense of belonging, but how can we really shift the culture and climate and the cues that students receive in their everyday settings to enhance belonging and sort of a population level approach. So it's a little easier for me to think of examples with other populations. So for example, how many academic institutions have portraits of past leadership on the walls, which are largely white men? So students are walking around their institution and what they're seeing on the walls are largely portraits of white men. That is a discrediting cue that can sort of seep into students' sense of their own belonging at an institution. I would love to brainstorm with this group and hear, like, from this group, thinking about what are things that could be done for first generation students? What do they encounter in their environment? What do they encounter as they move through the physical space of campus? What do they encounter as they attend class that might give them a clue or sort of indicate somehow that they don't fit, that they don't belong? And how might we shift those not only through, again, individual interventions are important. So peer support, social hubs. I think, TRIO programs are getting increasingly creative about how they're connecting first gen students to each other. How are they connecting them to their families to enhance their sense of belonging? But I would also love to hear any and all ideas or strategies schools are employing that think about sort of cues in the setting and how we can shift those as well.
Yeah, we just have a few minutes left, so I'm going to encourage you all to reply to Dr. Abelson's question in the chat or Q&A, and we would love to share it back with her. But I think that's an excellent point that you bring up regarding TRIO programs, and I know we have a number of individuals that registered and are in attendance that have some part and or development in TRIO programs at their institutions. So we encourage you all, if you feel comfortable in sharing or even want to pose a question of how might you advance that conversation, within your own institutions. And while we're waiting for maybe folks to potentially respond, there is a question about the Hope Center partnership. I know you talked about that. And so the question is just really regarding if there's a fee or how might they be able to connect with you or your institution.
Yes, absolutely. I appreciate that question and the interest in that work. Um, there are numerous ways that colleges can get involved in Hope Impact Partnerships. So we do offer the program on a fee base so that individual institutions who want to jump in and get going and administer the survey and participate can do so. We are currently enrolling colleges for our next cohort, and there is a link in the chat to learn more about the program and to gather more information from us. We do adjust costs. We care a lot about equity at the Hope Center and recognize not all institutions are equally resourced when it comes to doing this work. So we do take that into consideration and adjust costs and our structure there. But I will also start and highlight that we work with foundations and states and other entities to also support institutions' enrollment in Hope Impact Partnerships. So just as an example there, we currently have funding from a generous foundation that's supporting all Texas community colleges to participate in Hope Impact Partnerships. And are often working and collaborating with institutions to sort of pursue outside funds to support involvement. So there you can access it through our fees, but we'll also encourage you to be in touch with us as we pursue numerous ways and avenues of supporting institutions in this work.
Wonderful. And I just posted that link to the coalition letter. So if you have interest, please feel free to click on that, and your contact information will also be in the slides along with the other resources and references that were mentioned. And so I guess we're at time, 2 minutes left. We don't want to put another question there. But Dr. Abelson, thank you so much for sharing this very insightful information. I'm sure would be beneficial for our participants today as they navigate and think about a lot of the things that you share regarding first generation students. And so just one last time, if you are interested in obtaining CEU, CME credits, that code is 14SOAP, 14SOAP. Thank you again for joining us and have a wonderful afternoon. Thank you again, Dr. Abelson.
Thank you
Take
all
care,
for your
everyone.
time
Hope to
today.
see you next month.